In March 2020, following the outbreak of COVID-19, the UK government made a request for research. Scientists at the University of Bristol collaborated with head teachers to develop CoMMinS, the COVID-19 Mapping and Mitigation in School study. This was designed to find out more about the patterns of COVID-19 infections amongst school communities and their families, and what effect measures like hand washing and classroom bubbling could have on the spread of the infection. A new test was developed to make it easy for everyone to take part and provide samples. Over 2,000 people from 17 schools across Bristol agreed to join the study. Saliva samples were collected every month, and questionnaires completed online by parents and staff. In total, over 8,000 saliva samples were collected and immediately tested by PCR before being frozen for an antibody testing later. Lab results, including positive tests, were uploaded to a database to be shared with scientists for analysis together with data from the questionnaires. So what did we learn from all that saliva? Firstly, the low rates of infection when schools were open show that classrooms are not the source of infection we all thought. And mathematical modelling showed the isolation of positive cases is a much better way to reduce total pupil absences, instead of bubble quarantining or sending whole classes home. The antibody test showed the number of COVID-19 antibodies each of us has is linked to age, with antibodies in staff increasing in line with the rollout of the UK COVID-19 vaccination campaign. Thanks to the sub-studies, we also learnt that wastewater and sewage can be used to detect COVID-19 outbreaks. Small changes in behaviour like regular hand washing can have a big impact on the spread of infection. And this was made easier with the help of an app specially adapted for use by children. If, in the future, we experience a similar situation again, mental health and wellbeing support should be provided as early as possible, as measures designed to stop the spread of a virus can have a negative impact on staff as well as on children. Lastly, the digital team found that technologies such as facial recognition CCTV can be very useful for tracking people movements but raise other issues. Without Bristol school communities, we couldn't have confirmed any of these findings. And crucially, we learned an important lesson about motivation. Successfully completing a study needs dedication, and that's not easy. But it's clear from the numbers that pupils, parents, carers and staff are keen to play their part, helping understand how we keep future generations safe and tackling the spread of infectious diseases with exciting new science. By linking your anonymous data to the national study, our results, along with others from around the country, will help the government decide the best course of action in the future. We'll also be able to study the long-term effects of the pandemic on education and health for the pupils and staff in our local schools. As a planet, we're more connected than ever before. And while people can travel the world, so do viruses. Thanks to Bristol school communities, we have and will learn more to protect ourselves and others in the future. Thank you.